So in this series on understanding and correcting your lab markers, we are going to explore CRP, or which stands for C-reactive protein. CRP, or C-reactive protein, is representing our general inflammatory level. So what's great about CRP is it's a really important test to assess for overall health, but it doesn't tell us where the inflammation is coming from. When we're looking at CRP, my goal in all my patients is to have their CRP at 1 or less. The typical reference range that you'll see on a lab will be at from 1 to 5, and typically it's not being shown as abnormal unless it's over 5, even though optimal levels will be under 1. So there are 3 main reasons why CRP tends to elevate. First would be due to an acute injury. So if you sprain your ankle, if you hurt your back, this can cause inflammation in the body and then an increase in CRP. The other one would be due to an illness. So if you were sick, you had pneumonia, you had an infection, CRP can also come up because our immune system does mount an inflammatory response. The third and more important reason, and this is part of the reason why I do recommend rechecking your CRP if you were injured or you were sick, to assess if your CRP is elevated despite these reasons. But the third reason, and the most important, would be due to metabolic dysfunction. So when we have issues in our metabolism, more commonly elevated blood sugar, elevated blood pressure, or increased visceral fat, this can cause inflammation long-term, and it can actually predispose us to a lot of chronic health conditions, including cancer, diabetes, heart disease. So we definitely want to make sure that our CRP is in a good range, especially if it's due to a metabolic condition. So there are several ways that we can bring CRP down. The first is if there's any acute health issue, we definitely want to address that. Secondarily, what I found several strategies that we can focus on. The first one is actually fasting. Not everyone's comfortable with fasting, but I have found it to be relatively effective at dropping your CRP level. There's a couple ways that we can do this. In terms of prolonged fasting, 2 ways that I recommend would be doing a 24-hour fast once a week. During this fast, you'd consume water, salt, tea, coffee. Or the other way is to perform a 3 to 5 day fast every 3 to 4 months. If you choose to do any type of prolonged fasting, I always recommend prepping for the fast. And so typically 2 to 3 weeks before the fast, you would prioritize whole foods, making sure to get your starches low, having enough protein, and having somewhat of a compressed eating window so that when you go into the prolonged fast, it's not a shock to the system. If fasting for longer periods of time does not feel favorable for you, another option is to do a daily compressed eating window, about 8 hours, and to add in fasted exercise. So this can be before you have your first meal. Exercise in a fasted state does increase autophagy, or autophagy stands for autophagy, so self-eating. It actually helps to break down a lot of the inflammatory tissue. So either prolonged fasting or fasted exercise are 2 really effective ways. The third thing that has made a big difference, and I was actually surprised by this when I saw it on the blood in terms of the change in my patients, consistent cold showers. This one surprised me because I didn't see any data on it, but I think my interpretation of the situation is that cold water causes an increase in adrenaline, and the adrenaline actually helps to clear a lot of the inflammation in the body. So typically with cold showers, they are not fun, but you do feel great afterwards because of the release in dopamine. You want to aim for about 30 seconds to 2 minutes in the morning, and this is a really effective way to bring down the inflammation. So 2 other ways that we can decrease our CRP would be to limit seed oils in the diet. So these would be most forms of vegetable oils, predominantly canola and soy. These vegetable oils are present in all packaged foods, or most packaged foods if you read the label, and exclusively every restaurant that I've looked at. Even in Toronto, Whole Foods, which is deemed as a healthy restaurant, they are using canola oil on all of their food. The issue with seed oils is that when we consume them, the oils will actually start to replace the good quality oil in our cell membrane. So our cell, which is a circular shape, the outside layer of it has all different types of oils in them, and we want those to be good quality oils in our body so that each cell can communicate with the other cell. And when we consume seed oils, we actually start to deposit those inflammatory oils into the cell, and the cells can't communicate with each other. And so our metabolism shuts down, and we start to develop a lot of inflammation. So just by cooking your own food and reading labels on packages and removing those seed oils, it makes a massive difference in terms of bringing down your CRP. Lastly, looking at your body fat. So patients who tend to have body fat over 25% based on either calipers or a DEXA scan, they tend to have a higher CRP than patients that have a lower body fat. So that's always a good one to focus on as a metric.